Welcome Dr. Popper and Dr. Goldner. Hello, Dr. Goldner. Nice to see you again.
Good to see you too.
Thank you. Hi, Dr. Popper. How are you?
I'm great. It's great to be here again.
Okay, great. So it's a great opportunity for all of us to get two very knowledgeable, articulate, confident women who are leaders in the health field. So we're very grateful for this opportunity. So why don't you first, just by taking 30 seconds, to just tell us what you've been doing the last few years for people that are not aware of you. Dr. Goldner?
Oh my goodness, what have I been doing? So for people who don't know me, so I myself am an autoimmune survivor. I had lupus for 12 years of my life, almost died many times, kidney failure, blood clots, many strokes. So I went to medical school hoping to help other people with chronic disease manage their pain without trauma. Along the way, I was able to develop a protocol along with my husband, Thomas Tadlock, that actually successfully reversed the lupus, and I've been free of disease for 17 years. So we have given that protocol away for free for the public. I constantly am doing free Q&As for the public, classes for the public, because I want this to be a way of life for everyone. I want everyone to be able to grow old with the person they love and to be able to have children, things I was told I could never do. And at this point in time, tens of thousands of people from all over the world are free from autoimmune diseases like lupus, rheumatoid arthritis, multiple sclerosis, Sjogren's, mixed connective tissue disease. From my free content alone, personally, I've worked with thousands of people in reversing their diseases successfully. So yeah, I've been doing a lot of things. Yes, I've written books. I'm the first plant-based doctor in the Forbes Health Advisory Board. So that's been an exciting development this year because of how well our protocols worked for the public. But mostly I'm seeing clients. I'm helping people every day. Whoever can't do it for free, then I take the time for most people to work with them every single day so that I can help them do what it takes to get better and get their health back.
Thank you. Dr. Popper?
Well, I've been doing the same thing for the last year and a half that I was doing before. Our company specializes in informed medical decision-making, and we assist people in learning how to read the medical literature and interpret it properly so they can make good decisions about their health. And we do business in 33 countries. We have members in 33 countries. We own a school that teaches health professionals how to be in the business that we're in addition to the practice specialty that they might have. And so I think it's just all the same thing, only we do more of it every year, which is great. And the need for it, I will say that the last 3 years has motivated a lot of people to feel like they need a better understanding of what they're doing and why they're doing it. And so we've seen a huge increase in the number of people who are contacting us and using our libraries and asking for help and learning how to do this. And my best moments, I love when people get well. And I also love when a person goes back to a physician or a dietitian or whoever they're talking to with a good understanding of what the options are and the risks and benefits, and can have a conversation. And I'll tell you something that I've found that's been really reassuring or refreshing, and that is that a lot of health professionals light up when patients take responsibility for their health. And people who've told me that their doctors aren't interested, they change their stance when a patient comes in and is interested in helping himself or herself. So that's been a nice development too, is I'm seeing more people in the medical profession kind of coming around to this idea of patient engagement.
Great. Okay, so the first question is, a lot of us are very concerned about cancer, heart disease, Alzheimer's, but a lot of us are not really up to speed of what autoimmune disease means, how many people get it. Is this a big deal, or a lot of people getting this? Is this something we need to know anything about? How many people even have autoimmune disease?
I'll let you go first.
Okay. So autoimmune diseases are diseases in which your immune system, which is normally responsible for protecting you against things like infections, inflammation, actually takes over. And the immune system suddenly starts attacking your own tissues. And which tissues get involved really depends on the disease itself. So rheumatoid arthritis, people develop mostly joint pain, although they can also have things like brain fog and fatigue. Scleroderma would be skin. Sjogren's is your different types of lubrication, eyes, mouth, and other areas. Lupus can be anything. It can be in the heart, the lungs, oftentimes the kidney. And what's really important to know is that autoimmune diseases are on the rise. So while it was considered something that was more rare when I was diagnosed at 16, 30 years ago now, when I was diagnosed, they thought lupus was fairly rare and it was hard to diagnose. Nowadays, it's not. And what researchers have recently found is that autoimmune disease is on the rise by anywhere from 3 to 9% per year over the past 40 years, and have been spreading into areas of the world where it was not available, where we weren't seeing it before, like Crohn's disease in the Middle East. And so some researchers at London Frick Institute were trying to figure out, they're genetic researchers, and they were trying to figure out, is there a genetic cause? Why would autoimmune diseases be rising so precipitously so much over the past 40 years? And they were thinking there'd be a genetic component. And what they actually concluded was that the rise and spread of autoimmune disease exactly mirrored the rise and spread of the Western diet. So it's really just confirming with those of us, I'm sure Pam Popper's not surprised to hear that. And a lot of the people who have been teaching here are not surprised to hear that. But a lot of the population, that was news. It's actually a local news show was talking about that, because people are surprised to hear it, that they're familiar with the idea that there might be a food component to diabetes, cancer, heart disease. But with autoimmune, they've really tried to say it's purely genetic, and it's not the case. I know that because it was my diet that got rid of my disease. And so current studies are really just showing what we have already been seeing for a long time, at least in our practice, and the power of autoimmune disease, or power of diet, really, in autoimmune diseases. So yeah, the numbers are kind of different. It depends. Like with lupus, they say maybe there's about 5 million, but they also say that most people are undiagnosed for years, maybe even a decade, before their doctor figures it out. So I think it's much more than people think. And either way, it's dramatically going up, and it's connected to the way we eat.
Yeah. I would echo that. And the thing that I have noticed that's even maybe more terrifying is the average age is going down. I've been in business for 27 years, and maybe once a year we would be contacted by a parent who had a child with juvenile rheumatoid arthritis or inflammatory bowel disease. And now that's an everyday occurrence. And so I think we have a generational problem in terms of food. And one of the ways that I explain this to parents is, when I'm 66 years old. So when I was a kid, there wasn't any such thing as kid food. It was just food. And I grew up in a family that, at least when I was a little kid, didn't have much money. So scratch cooking and gardens and that sort of thing were kind of how we lived. And so everybody ate the same food. Now we have probably the 3rd or 4th generation of people eating kid food, which is just a code name for garbage. And so the diets are starting earlier and earlier to be terrible. And that's bringing the disease on earlier and earlier as well. And I think that's the most terrifying thing, because if some of these children are not shown how to eat their way and change other factors that lead to autoimmune disease, their lives are going to be shortened. There's no way you can be diagnosed with Crohn's disease at the age of 5 and take drugs and expect to live your full lifespan. It's just probably not going to happen. And that's a terrifying thing for a parent to have to face.
And it's an excellent point, and it's across the board, right? I mean, I just a couple of weeks ago was asked to talk on the news about how now they're finding colon cancer is surging in people who are in their 20s. And before that, I had to do one on how many kids now with type 2 diabetes, how much more there are than ever before, and how kids are having high blood pressure. I mean, when I was in medical school, there was no type 1 and type 2 diabetes. It was adult onset was the one that was type 2, because kids didn't get it. And now it's common for kids to get it. So we have a rise of disease in all areas in children, even things like depression. So I definitely echo what we just heard, that, it's the poor eating that we have in our world, and how it's spreading throughout the world is causing children to get sicker across the board. Although they only like to talk about one news story at a time, it's pretty clear that our children are sicker than they've ever been. And even 10 years ago, they were saying that the next generation of kids are not going to outlive their parents, where in the past, every generation did better. We're going the other way now.
Yeah, absolutely. And I was asked on a radio show a couple of years ago, this was kind of an interesting thing. The person interviewing me said, what would you say is the most difficult challenge you face when you're working with people to change their health? She says, I bet it's trying to talk them out of eating dairy. And I said, well, first of all, we don't try to talk people out of doing anything. We think that showing evidence and then letting people decide. And most people, when they look at evidence, they do decide to, for example, stop consuming dairy products. But I said, that's really not it, because it's pretty clear when you show people the evidence that this is not a good food for humans. You know what it is again, going back to my childhood, and I know I sound like I'm 197 years old, but yeah, and I was walking to school uphill barefoot, but really when I was a child, my grandmother and my mother both shared a common habit, and that is they would figure out what we were going to eat for the week, and then they would make a grocery list, right? And go to the grocery store and buy food. And I remember my mother taught piano lessons a couple nights a week, and my father, she'd leave instructions on the refrigerator for what he was supposed to make us for dinner, and the ingredients would be in the fridge. So eating was planned, and it was planned for health, right? By default. I mean, again, we didn't have money to buy thick steaks every night and that sort of thing. And the stores were not full of ice cream and all the other garbage that people take home. So when we start working with people, one of the biggest challenges we have is showing them that you can't just wait until 5:45 and say, gosh, I wonder what we're going to do for dinner. Because that's, people stop by Applebee's to pick up food, and it's not because they actually think that that's a good idea. It's just they don't have anything else in mind, and it's crunch time, And we spend a lot of time in our office working on those issues with families.
Okay, so let me skip ahead to the last question, then we'll come back. The last question is, okay, so assume we follow everything you suggest perfectly, and assume that, people are listening to you carefully and doing it. What are the results? I mean, are you saying that if you see 1,000 people, 1,000 people are all cured and live to 110? Or do people still get cancer and heart disease and still get autoimmune disease? Like, how well does this protocol work? How many times does it not work? What's the benefit of following your lifestyle approach versus some other one? Is it work? What percent of the time does it work? How often does it not work? What are your real world results with your patients?
I'll let you go first.
I went first last time. Go for it.
Okay. All right. Well, I think the first thing is the results are highly variable because the people present themselves in highly variable conditions. In other words, there's a difference between somebody who is diagnosed with rheumatoid arthritis, for example, a few weeks ago and is just starting to explore what to do and ends up finding us before they've been ravaged by the drugs that are actually not so effective and can make things worse, and years of bad eating and that sort of thing. So that person is going to have a better outcome than a person who has 6 or 7 autoimmune diseases, and the first one started 40 years ago, because the likelihood that you'll develop more than one autoimmune disease if you have one is very great. And so you're going to see a lot of highly variable outcomes based on the condition of the patient upon arrival, the how much drug treatment they've had, the mindset. We call it the X factor in our office. I've seen people who you would not think could get well who do, because they make up their mind to, and I've seen people who should get well who don't. And there is the X factor as well. The other thing that I tell people is it's always worth doing. In other words, if you take a look at the progression of autoimmune disease, you will develop more autoimmune diseases, and your life probably will end early. That happened to my mother, by the way. It runs in my family as well. And so if you can live your full lifespan, even if you can't reverse the disease, that's a win. And I think the beginning, I don't want to promise outcomes to people. I think it's irresponsible, but this is a way that I explain to people how this works. Let's say you walk into my office, I have this huge gash on my arm, and I'm dripping blood on the floor, and I'm picking at it, okay? And I'm complaining the whole time while I'm picking at it that it won't heal. And at some point in time, you, the client sitting across the table from me, might say, you know what? If you stop picking at that sore, I bet it's starting to heal. I bet it will start to heal. And they would be right about that. So the first step is you stop picking at the sore, which is you clean up the diet and all that sort of thing. And then you just see how far you can get in recovery. And sometimes it's astounding, the ability of the human body to restore itself to health if you just do the right things. So you can't guarantee an outcome, but you can guarantee that if you stop picking at the sore, things are going to start to get better. And that's the dietary change that can lead to better health. Maybe not entirely recovered health, but better health. couple examples I'll give you, and then I'll turn it over to Dr. Goldner. I have a couple of rheumatoid arthritis patients who came to me after the disease was already progressing. And you can see some misshapen joints, and that doesn't reverse itself. But they're not taking any medications, and it hasn't gotten any worse. One of them for over 20 years, which is remarkable, because had this person continued down the path of conventional medicine and just taking drugs and not changed the diet and all the other things that we have talked about, by now, I'm sure would have been in a wheelchair. Again, I saw that happen with my mother, who had rheumatoid arthritis and wouldn't listen to me. Can't be a prophet in your own land. So.
I always say it's hard to raise your parents.
Very, very.
Yeah. So I have a different experience in all of this, and also what I can say is that while I agree that, you know, every person comes with a different story and a different background, what I've been able to see is that when people do apply hypernourishment, which is what my protocol is called, to their life, their health always gets better. That there is no downside, unlike a lot of fad diets out there. It's not like you start eating lots of nutrient dense, healthy food, and then some people get better and some people get worse, right? People's health gets better, and it starts to get better fairly rapidly. It's the only reason people know who I am. I was purely organic over a short period of time where people just started getting better and sharing it. And I went from a doctor treating the homeless, trying to be an unknown, to doing things like this, right? And so my protocol is very specific for cellular repair and autoimmune function. So when people start applying the nutrition to their lives, their health starts to get better. Now, how well they stick to it, now that starts to make a difference, right? And so what I found to be the most important and profound in helping people recover is actually helping people do it. There's so many people. I've actually had a different experience where the information has not been enough for people on its own. There are so many people I talk to who go to so many of these conferences. They will sit here on a Saturday night on Mother's Day weekend to listen to every expert they can, and then they're still going to eat something crappy over the weekend, because it's not just about information, but it's about addiction and culture and emotion and so many other things that keeps pulling them back, or even your environment not being supportive. And so it's been really important for me to help people learn how to apply the information. And I'm also a trauma specialist, and I'm aware of how, you know, with people with autoimmune diseases, there's much higher amounts of people with autoimmune disease with trauma and anxiety and depression. There was one study where they looked at people with autoimmune in the hospital, and those are people who are obviously very sick. And over 60% said that they had had some kind of childhood trauma. So when we're talking about nutrition, diet, lifestyle, for a lot of people, it feels very invalidating, because yes, they want to do better and they're listening, but they don't know how to make themselves do it. And so that's why I even created programs. I work with people every day, because I know I have to get them through all of that time in the beginning, through the food addiction period, through their insecurities, to help them deal with family reunions, to help them through their down days, to help them cope properly through negative emotions, stress at their work, and have them learn how to solve problems, and also how to focus on gratitude. In my rapid recovery groups, one of the most common feedbacks I get is, it's wonderful not to have any more pain, but learning how to be joyful and grateful has changed my life. And so I really try to download all of that for people, that if you can get people into a state of happiness, or they understand how to work through their stress and their food addictions and their peer pressure and everything else, then they can integrate this information, and the healing is rapid and profound. So for example, we just had a group of 60 people go through my rapid recovery program, and every single person in the live meeting had profound results. Many of them were completely symptom-free, and that's talking about 42 days. So the results are profound, but it's getting people into action that I think is the most important. And I also I start with people like, add what you're missing first. Even if you're not ready to give up that burger, all right, well, let's add what you're missing. Let's get you nourished. It'll crowd out some of the junk, and you won't have any of that all or nothing thinking going on, so that we can get you to a place where you will kind of more naturally step into this better way of eating. But every step they take along the way is getting them healthier and healthier, with really no downside. I mean, even if you still have a pain left because you're not 100% committed, cholesterol is coming down, blood pressure is coming down, all these other things are happening. And we use that then to compound that motivation to keep them moving forward. And I think also for me, that inspirational piece is something that people can connect to, because I never tell people to do something I'm not doing. It saved my life. And I'm really, I understand the life of chronic illness and how hard it is. And it helps me connect with them in those moments when they're feeling like they can't, and help them get to the point where they feel like they can.
Thank you.
Yeah.
So let me ask you this. So what is the very specific protocol that each of you use when someone comes to you with autoimmune disease or other diseases? What is the exact protocol that you give them?
Well, so these guys didn't come to our lectures? Okay, so the hypernourishment protocol really specific to an intentional overdose in the nutrients for cellular repair and optimal immune function. So the way we create that overdose is with high doses of the vegetables that have the highest dosage of the vitamins, minerals, antioxidants, et cetera, that your body uses. So especially cruciferous vegetables in the raw form, high doses of omega-3 fatty acids. We like flax and chia seeds, they work very well. And hydration, neglected in most areas of health, but water is important for all the chemical reactions that accelerate cellular repair and healthy immunity. So I really focus on helping people nourish themselves as well as possible with those ingredients. And then depending on the level of their illness and how quickly they want to progress, some people will focus on those foods and others will incorporate it into a plant-based diet where they remove the inflammatory stuff that, meat and dairy and processed junk. I won't call it food, processed junk, but they take that stuff out. So wherever people are ready to go, we can start with just adding hypernourishment. We can take out the bad stuff and do hypernourishment on a plant-based diet, or we can do aggressive hypernourishment, which would be the Goodbye Lupus protocol. And then if you include the emotional health and lifestyle changes and working through traumas, then I call that the Goodbye Immune Disease protocol. So it's levels depending on where people are ready to kind of, whether they're getting their toes wet or whether they're ready to dive in.